I'm kidding.
SI joint issue. So as I brought the towel down, Lindsay has good definition of the sacrum, and of course we're not going all the way down to the coccyx. All right, so we're kind of up at this point where we can get the most part of that posterior iliac crest, the PSIS, the upper portion of it, and then we also have, you know, this top part of the sacrum right here. So what we're trying to do, did you guys bring the bottle? What we're trying to do is, the treatment here, it's going to be a little bit different than what you normally do when you guys are effleuraging the back. So here now it's going to be a little bit more localized. So the first one I'm trying to locate, and what I'm doing here, excuse me, Liz, I'm not gonna cut you. But what I'm doing here, I'm just getting my hand placement in here. And it's kind of like a little rocking action to get some mobility in there. So I'm just trying to, you know, get a couple, 1 to 2 millimeters, just very slightly, just to get some movement in there with my rocking action. Then I'll come off and loosen up the ligaments and that fibrotic tissue here, and then return to that area. All right. So you'll see here, I can do a hand over hand, but I could actually feel that opening right in here. Just let me know if that's good.
Yeah.
And you see I'm looking at the leg, because I'm making sure that I'm doing my rocking action. Just let me know when it's too much.
Okay.
That's good?
Yeah.
Oh, okay. Because for some it can be a little discomfort there. So you notice I'm not doing what you guys have been doing, this friction, and I'm actually getting in with some joint mobility work. All right, I'm not frictioning that area. I'm trying to get in and kind of get into that space. All right, then I may back out of that area, and then with some circular friction. So for what you guys have been doing now, for the most part, you guys are probably stopping here or where that tuck is. Some of you guys, you may be coming up the top part of glute med. But here, now, it starts to V, kind of create that V. Your fingers are going to be a lot lower than it normally is with the tuck with the towel or the drapes. So it's to the point where you're going to start to see the crack. All right. So I'm here. Doing my circular friction, and then I'm going back in to my mobility. So here my eyes are here. I'm just looking, see if I can get some movement in there. So here we're addressing the SI joint dysfunction. We're getting in between here to get some movement, some mobility in there. Get some movement. You okay?
Mm-hmm. Isn't that table a little too low for you?
Yeah, we gotta bring it up a little bit. But I make adjustments with tables. Where is it at?
It seems like
On the right side.
Bring it a little bit. There we go. Keep it right there. The reason why I go a little bit lower, because my line of drive, for me to go deeper, the table has to be lower. If it's higher, then I lose all of my All right, so I'm staying around that area. To loosen that up. So I'm just going back and forth to see if I can get some, you know, going from like a 8 or 7 to a 6.5 and see how that feels with them. After that, then can go ahead and do what you guys have been normally doing with the thumbs on the fascia. So now I'm just sinking in this portion right here, which is the fascia is pretty thick. See, like this area right here. So now that's where most of my pressure is. So as I got here, it wasn't that much tissue. It was, I can basically feel these two bones, the SI joint. All right. But then as I get here, now I got the thickness that I can sink into. All right, so that takes care of that. And then as we move on to the piriformis syndrome or the sciatica, I'll come around here. And I didn't grab that. All right, so now we're dealing with this, sorry, Lindsay. Now we're dealing with this piriformis muscle. So remember, it starts on the inside of this sacrum. Comes across on this greater trochanter. So whether you want to do this to find it or find that greater trochanter, it sits right in, like right in about this point right here. So greater trochanter is here, and then I sink in right about here. So we know we're dealing with, as this heel goes in, that knee pops out, we're dealing with the lateral rotators. They're coming out. All right, external rotation, knee goes inward, internal rotation. So very simple to get a release of this, what you guys have been doing. You can do fists, you can sink in with the elbows. Your fingers are strong enough, you can get the fingers in. Doesn't matter what you do, but that piriformis muscle will pop out under your fists, your elbows, or your fingers. And you want to make sure you get in deep enough where the movement starts to slow down. So if you're doing it and you're able to swing the leg, then you're not getting in deep enough. You want to kind of limit that movement. You okay, Lindsay?
Yeah.
All right. If I sink in, so you can see now his limit is, I'm on that piriformis here. I'll back off. So keep in mind that sciatica, it actually